Hello and welcome to this edition of Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and today let's tackle a question that affects every single one of us. Why are we missing the mark on preventative care? This is by far one of the most effective ways to lower healthcare costs and improve quality of life. So in this episode, we'll explore why preventative care is so important. We'll talk about what happens when we neglect preventative care. And we'll talk about some of the barriers to accessing preventative care and what we can do to change that. So buckle in, and I'm glad to have you here for this edition of Your Health, Your Wealth. Why do we wait until we're sick to see a doctor when prevention can save us literally billions of dollars in healthcare dollars? Preventative care, and when I talk about preventative care, I'm talking about things from vaccinations to just your yearly wellness checkups, to screenings, mammographies, prostate screenings in males. All of these things go under the umbrella of preventative care. It's one of the most powerful tools that we have available in medicine because these programs are designed, and when you put them through collectively, they really save in future healthcare dollars by preventing what's called catastrophic care. So when you look at chronic diseases like heart disease, cancer, they're responsible for 7 out of every 10 deaths in the United States. They also account for about 75% of healthcare spending. That's 75%. This reminds me of the old 80-20 rule, where 80% of healthcare dollars is only from a few conditions. And, these chronic conditions tend to eat up or gobble up so much of the per capita healthcare dollars. When if we really implement preventative care programs, we can reduce some of these impact from some of these chronic conditions. So, for example, colonoscopies can detect colon polyps before they become colon cancer. So there's a way that you can intervene and prevent colorectal cancer by having these screening colonoscopies. If you manage your high blood pressure, you can reduce a stroke or a heart attack. Both of these conditions can lead to premature death, hospital admissions, a lot of long-term care, including physical therapy. But just by managing your blood pressure and getting yourself on a good treatment regimen, you can hopefully reduce that. Vaccines. I know vaccines are a hot topic, and this is by no means politicizing this, but vaccines like the flu shot reduce hospitalizations. People still die from the flu. Don't get it twisted. People still die from the flu. And I've even gotten the flu after having a vaccination, but guess what? It wasn't as severe. I didn't have to miss multiple days from work and so forth because the flu had less of an effect on my body because I had the vaccine. So vaccinations do fit into this umbrella of preventative care. Now, beyond saving lives, preventative care saves money. This is Your Health, Your Wealth. So we talk a lot about the healthcare system and the per capita. And there's a study by the CDC that found that every dollar spent on childhood vaccines saves over $10 in future healthcare costs. So this is real. And it's something that when we talk about preventative care, understand that this fits into this whole notion of how do we figure out ways to reduce the healthcare expenditure in our country and at least put our country on parallel levels with other countries when it comes to healthcare spending. So let's talk about healthcare dollars first. Treating advanced stage diseases is exponentially more expensive than preventative care. So if you think about walking, you can put on some shorts and go outside and walk, and for the most part, that's free. But if we don't walk, or if we develop this constellation of symptoms called metabolic symptoms, which is high blood pressure, diabetes, high cholesterol, overweight or obesity, then that's going to have high cost long-term effects on your health. So the annual cost of managing diabetes complications like kidney failure and amputations can reach tens of thousands of dollars per person. Again, when walking is free. And I'm not trying to minimize it, but this is just one example of a preventative tool that can help. Cancer treatments for late-stage diagnosis often cost hundreds of thousands of dollars compared to early-stage interventions that are far less expensive. So getting your screening mammographies, colonoscopies, all those types of things can help long-term. By neglecting preventative care, it's not just about money. It's actually about your quality of life. I have seen and I take care of patients who've had a stroke. And having a stroke where you have weakness on one side or the other, that has a big impact on your life. You have to go to rehab. You may have to not work in the same environment that you worked before. All of these things are some of the complications of these long-term chronic conditions. I'm not saying that all of them are preventable, but they can be through some of these preventative health steps that we'll talk about. It's a financial and emotional burden to the whole family. I mean, when you have a condition and it causes you to be disabled, that has an effect on the whole family. You have to have caregivers take care of you, maybe drive you, go to multiple doctor's appointments and so forth. So if we can take those tools and take that initiative within ourselves to try to get our appointments, do our screenings, cancer screenings and that type of thing, can have a huge long-term effect, not just on you, but also your family as a whole. And avoidable emergency room visits are another major issue. Nearly 2/3 of ER visits are for conditions that could be managed in a primary care setting. I mean, I'm talking about things like asthma flare-ups, minor infections. Each avoidable ER visit costs an average of $2,032 compared to just $167 for your physician's office visit. Years ago, there was this explosion of urgent cares at every corner. And urgent cares are a vital part of this whole healthcare system and emergency rooms. I've gone to urgent care. I've gone to emergency room. It's needed. But the problem is, are we using emergency rooms the right way? You have people that go into the emergency room and they're triaged and they're sitting there because you have others who are there just because they ran out of their medication and they don't have medication. They don't have a primary care. So they use the emergency room as a means to take care of their primary care needs. So we really need to look at this, especially when we're looking at the staggering costs of emergency room visits. Did you know, actually, that the emergency room for preventable conditions costs over 10 times more than just visiting your primary care physician? So how do we avoid this domino effect of not taking care of our health care on a preventive side and then ending up in the emergency room or the hospital in catastrophic care? I mentioned earlier, sometimes people end up in the ER just because they run out of medication. So how do we utilize technology or ways to make sure that people get their medication so they don't end up in the emergency room and hold a position or a seat for someone who really does come in with an emergency that needs more immediate care? So the high cost of ER visits drives up the premiums from everyone. That is how this issue does not just affect those going to emergency, they affect everyone. So not just those in the ER necessarily, but also those who don't go because their insurance companies are going to raise premiums. They're going to offset the cost some kind of way. And they do that by raising the cost or the premiums for everybody. The other thing is these avoidable ER visits, they clog up the emergency room and make it hard for patients with true emergencies to really get the care that they need. And patients who rely on ERs often miss out on continuity of care, since they go to the emergency room. So they don't go to their doctor. They don't take care of these long-term chronic conditions like high blood pressure and diabetes that can prevent them from having problems long-term. So the question that I have for everyone listening is, if preventative care is so effective, why aren't we using it more? Why aren't people doing it? And there are a number of barriers that really stand in the way of really using preventative care. A big barrier that I think about is, number one, healthcare is reimbursed more for catastrophic care, surgeries, hospital admissions, time in intensive care unit. Intensive care unit stays are thousands of dollars per day. But there's no real reimbursement for preventative care other than just an office visit. I literally can spend over an hour talking to a patient about the importance of exercise and diet, changing their diet for their condition. And, that's reimbursed at the same rate as a regular office visit. Now, there are certain new changes now that the Health and Human Services is trying to make to try to reimburse more for some of these chronic care codes and so forth. But for the most part, it's just not reimbursed the same. Routine screenings like mammograms or cholesterol checks are often covered, but they remain underutilized due to some of the misconceptions about the cost, and do you have to cover that and so forth. So making sure when you have insurance that yearly mammograms or your yearly well checkups are covered is very important. Vaccinations have become very politicized in today's world, as we mentioned earlier, and this has become a barrier for a lot of people not wanting to use them. And another issue is the cultural mindset. And in the United States, we tend to focus more on this reactive care. We focus more on doing something, fixing a problem, like I mentioned, surgery, as opposed to proactive care, meaning taking those lifestyle changes, changing your diet to have more of a better long-term effect. So it's a mindset shift that we need to go through, and a real fundamental mindset change in our healthcare system to make that shift from talking about this catastrophic care or reactive care to talking about more of the preventative care. Systemic barriers still play a role. Rural areas often lack access to primary care physicians. Underserved populations, transportation problems, and language barriers, make it hard for you to go see a doctor. And food deserts is an issue that I think that's ignored, in that I can sit there and counsel about the importance of leafy green vegetables and eating right, but if you don't have a good grocery store in your community, or if you do go to the grocery store and all they have are foods that don't fit into this bucket of healthy diet, then you can't follow that advice. I've had people I've talked to about, hey, establish a walking club in your neighborhood and get out and then walk. And they say, Doc, you know how unsafe my neighborhood is? If we establish a neighborhood walking club, we might get shot. So, we have to think about those type of socioeconomic barriers that could come to play when it comes to barriers to preventative care. And for the most part, people want to do those things, but they just may not know. The lack of primary care access in these communities is pretty staggering, and it's something that as a nation we need to focus on and really do something about. So how can we shift from more of a reactive to a proactive healthcare system? In my view, education is the key. We have to start educating, and we have to start educating early. Schools need to start teaching kids, even at an early age, the importance of preventative health. Childhood obesity, the rates are going up, and I think that's because we've stopped talking about, get out, exercise. Now it's about video games and social media. But what we need to start teaching, especially kids, about a healthier lifestyle and how things like exercise affects you mentally, emotionally. It fights depression, and it helps you physically by lowering things like your blood pressure and your weight and so forth. So the schools play a vital part. And if we can institute these early intervention thoughts into our kids early on, then there's much more of a chance that they'll take this into their life and continue these steps moving forward. Employers can offer a lot of workplace wellness systems. Everything from I read a book years ago about Google, and they have meditation pods around their campus in California. So how at your workplace can you initiate wellness programs? There are certain incentives or health benefits to wellness programs, and making sure that workers can stop and take breaks to walk and so forth. So using the workplace as an environment to promote wellness is a very good tool and a very effective tool that's underutilized. There are a lot of community-based programs like the National Diabetes Prevention Program, that have demonstrated success in reducing disease incidence through lifestyle interventions such as weight loss and physical activity. Another big game changer that I think will be technology, wearables. I got on a wearable ring, and an Apple Watch, and I track my sleep, I track my steps, I track my activity. So using AI and using wearables to make sure that we're keeping an active lifestyle, even continuous glucose monitoring. Even if you don't have diabetes or pre-diabetes, there's evidence that shows that just by wearing a continuous glucose monitor for part of the month, you can really see how your diet is impacting your blood sugar levels throughout the day. And this can lead to weight loss. This can lead to more activity and an overall healthier lifestyle. So I'm excited about where this trend as far as wearables is going. There's a lot happening in this space. I've heard of even wearables now that's known as invisible wearables, where they can be a flower pot or something on your wall, but it's continuously throughout the day tracking your movement, tracking your activity, can even track your sleep. Now, there's a lot of ethical things we have to make sure with that, but the wearable arena and AI, when it comes to preventative health in the future, I think is going to really help us out to give us some of those tools to be able to make those type of changes in our life. And lastly, policymakers have got to keep track with this and expand preventable services through policy, making sure that we increase access in rural areas of America, access to primary care, access to food and vegetables and grocery stores. Our policymakers really need to step up and think about the reimbursement issue when it comes to how do we adequately reimburse docs for really pushing preventative health. So some of these new incentive-based programs that have to do with outcomes, may help. It's something that we need to continue to watch and make sure that we are, as a nation, pushing vital issues such as preventative health. So how do we build a culture of prevention? There are steps that we can take as individuals and as communities to build or change this culture, to shift the mindset more towards prevention as opposed to catastrophic care. Number one, schedule your annual visits with your primary care provider. There are so many things that are caught at these annual visits. If your primary care doc is tracking things like your weight and blood pressure, your blood sugar, your cholesterol, they can find these things like pre-diabetes before it becomes diabetes, or they can catch high blood pressure and maybe advise on, let's make some lifestyle changes. Let's increase exercise where you don't even have to go on medication. But if you don't do the annual visits, if you don't see a primary care doctor at least once a year, then a lot of times these things are missed and can go unchecked and lead to more catastrophic things that need intervention at that time. So schedule annual visits with your primary care. And this is a powerful way to, again, change or shift this culture. Almost every insurance now is mandated to cover at least yearly visits. So there's not a lot of excuses not to establish care with the doctor and at least have a yearly physical. Number 2, follow national screening guidelines that are tailored by age group. For example, this could be mammograms starting at the age of 40 or colonoscopies starting at 45, prostate checks. Take a condition like prostate cancer. Prostate cancer can be very treatable if caught early. So if you're having the prostate checks, or we talked earlier about colonoscopies and finding the polyps before something becomes cancerous, if we pay attention to these screening guidelines, it can help us to catch things before they become catastrophic. Number 3, take advantage of free or low-cost community health activities and resources such as vaccination clinics, such as wellness programs, walking clubs, all these things that are provided in the community. Take advantage of it. And that is one way in which you can really find out. I participate in health fairs all over the city and in other states as well. And that's a great way to get information, to talk with a doc and really find out about tools that you can implement in your own life. As a community, a couple of tools. Number 1, employers should offer incentives to employees to participate in wellness programs. This is a way to get your employees healthy. They miss less days because of being sick, and they feel overall better when they're at their job and they realize that their employer cares about them and cares about their overall health. Number 2, policymakers need to explain access to preventative care services while addressing health needs in rural communities. This issue with rural health is one that we need to come to grips with, and it's going to take a collective effort on everyone's part, and especially policymakers, to make sure that healthcare access and coverage is equal, and that those who most need it can take advantage of some of these preventative guidelines. Collectively, we have to find a way to reimburse physicians for preventive care, and schools should teach children about healthy habits so they can grow up and understand the importance of prevention. And lastly, take time to exercise with your friends and family. Make it social. Make it a fun thing. Make it, like I said, walking club or some type of challenge. This makes it sticky. This makes it more likely that you will do and something that you will continue to do, and make it enjoyable. And what you'll find is that by taking these small steps early in life can help to prevent catastrophic and serious long-term or chronic health conditions in the future. Well, I hope that you found this episode helpful. If you have, please share it with others, and don't forget to subscribe and leave a review. And join us for future episodes of Your Health, Your Wealth. If you want to learn more about me, you can go to EddiePattonMD.com. Thank you again for listening to Your Health, Your Wealth.